Greetings. Welcome to Caregiver Chronicles, Friday Night Live, Ask Dr. Yvette Anything. I want to first of all tell you a little bit about Caregiver Chronicles. Caregiver Chronicles is a 16-module online course for caregiving. We cover all aspects of caregiving from the onset of your loved one's illness all the way until they transition home to be with the Lord or until they recover from that illness. And so tonight, we have a couple of special guests with us tonight. We are going to be talking about medical insurance. And so we have two ladies with us tonight. I'll introduce them to you. The first guest is Marcia Miller. She is a Medicare broker and she has 10 years of experience. Say hello, Miss Miller.
Hi, everybody.
Okay. And then we also have Tonda Moses, who is also an insurance agent, and she has been an insurance agent for over 30 years. So say hello, Miss Tonda.
Good evening, everyone.
All right. Thank you both for joining us tonight. So basically what we're going to do tonight is talk about medical insurance. And the reason why we're having this topic is because medical insurance is one of the most important areas that needs to be discussed or needs to be addressed when you are a caregiver. And so with that being said, we'll kind of go through our outline of what we have to discuss tonight. And then our guests will talk about their expertise. We'll talk about some other things. If you're listening in, please don't hesitate to comment or come join us in the chat. And whatever your question is or comment, please type it in and we'll be happy to respond to you. Just let me also tell you that you can also visit our website at www.caregiverchronicles247.com to get information on all of the courses, as well as private consultations, and have consultations with me as well. So let's get started, ladies. Thank you again for joining us tonight. You can stay unmuted. You don't have, this is an open conversation, so you can, all chime in at any time, okay? So there are many areas of insurance we want to talk about tonight. The first area we want to talk about basically is Medicare. We're going to talk about Medi-Cal and Medicaid also. We're going to talk about being Medi-Medi, which means you have both coverages. You're considered low income with both. And then we're going to talk about private insurance, HMOs, non-HMOs, and PPOs as well. So let's get started. Ms. Miller, I know that you have a PowerPoint. So what I'm going to do is pull that PowerPoint up here and share my screen. So that way you can kind of go through the information that you have. Does that sound okay for you?
That sounds perfect.
Okay, perfect. Okay, give me just 1 second here. This is a unique experience, of course, sharing the screen. So let's see. Okay. Okay, let's see here. All right, is it on the screen there? Can you see it on the screen?
It is. We can see it on the screen.
Okay, perfect. All right, so let's get started then. And you can tell me when you want me to, go to the next slide, or we can kind of move through because I know you have quite a few slides. And Ms. Miller, I cannot see you. Is your camera off at this time? Can you see her?
I see her.
You can see her, but I can't. Okay. So, okay. So
I think because you're sharing your screen, right?
Have the screen share. Okay, so let's go then. So now we have Medicare Basics 101. Let's get started with that. Go ahead, Ms. Miller. You can talk about your PowerPoint here.
Okay, we're just going to go through the Medicare Basics 1. And just for your information, this information is provided to you.
Ms. Miller, the sound went off.
Oh, and she's off as well.
You can't see her either?
No, her video went out.
Okay, so I tell you what, she may have to call back in.
Okay.
I'm here. You know what? I'm here. I may need to switch laptops or something.
Yeah, well, you're breaking up too. So I tell you what we'll do. Let's switch over to Miss Tonda, and let her present, and then we'll come back to you. Okay. So what I want you to do is, try to get, if you need to switch over or hang up and call back in, you can go ahead and do that. Okay. So give me just a second to get the other PowerPoint up for you, Ms. Tonda. Okay.
Okay.
All right. One moment. Okay. Let's see here. See if I can share it. Where is the screen share? There it is. Okay. All right. Now, Ms. Tonda, can you see it on the screen?
There you go. I do see it. And can you hear me okay?
I can hear you fine. Thank you. Let
Very
me know when
good.
you
Okay.
switch over. Go ahead.
Okay. So private insurance, a need that's needed. I titled it as that because over the years I've seen people without insurance, and I've also seen how insurance helps. It's important to be covered. I couldn't say that enough. It is very important to be covered. All types of insurance is very important to have because it helps in the end. It helps with a peace of mind. And a peace of mind is what we really all need, especially in these times. We don't know what's coming down the pike. We don't know what's happening with illnesses. There's a lot of mental health issues going on. We need extra help. And one way I see that we get it is through insurance. Very important.
Right.
Next slide, please.
Right. And you know what, too? It's so important because when we have an illness, you can run up thousands and thousands and thousands of dollars of medical bills if you do not have insurance. So that is critical.
Exactly.
Yeah. So here's your.
So on this slide, why it's important, and just as Dr. Yvette was saying, cost, out-of-pocket cost is so important that it can be huge. You hear of people saying file bankruptcy and I can't afford to have, chemo treatments, or I can't afford to continue this or continue that. Out of pocket, yes, some plans have out of pocket costs. If you don't have insurance at all, you're looking at out of pocket costs. And providers want to be paid, as with anything. So it's important to know that when you have it, you can minimize or eliminate some of your out-of-pocket costs depending on the type of plan that you have, and we'll talk about that next. Provide peace of mind. That is so important, to provide a peace of mind.
Right.
To know that I have coverage. And a good thought of it is, I had, my mother is in care, and I had to go buy medical supplies yesterday, and here I go into the store, into the medical supply place, and I'm buying things, not remembering she has insurance.
Right, and the insurance should cover it. Yeah, that's right.
Yes.
But you know what?
It's
funny that you mentioned that, because a lot of people don't know that there are items that you go in the store and pay for that your insurance may cover. So it's really important too to ask. If you don't know, just say, oh, will my insurance pay for this? When you get ready to go pay for it, find out if your insurance will pay for it. Because a lot of times insurance companies don't get to provide all the services that they should, because we don't know, and people don't know what they cover. And so that's important too. Very critical.
So true, so true. Yeah. Next up is quality care. Not saying that you have substandard care when you don't have insurance, because we all can get it. But when you have insurance, you have the opportunity to pick better doctors, or get better types of care, because the provider knows you have help paying for that care. So sometimes you can get quality care when you have insurance, no doubt about it.
Right.
The extra benefits and or services especially with senior plans, some of them offer extra services or benefits like dental or vision or exercise programs or
Right.
transportation, or one good service on a plan is durable medical equipment. One thing I forgot, my mother's plan actually had. So now I'm going through her booklet saying, what else can I get? And can I get reimbursed for the things that I did purchase?
Right.
Choice of plans. Choice of plans is very important. You have options. We're in the state of California. We have options of the types of plans that we can select, the types of products between the plans. We'll talk about that, whether it's an HMO plan or a PPO plan. And we have networks. A lot of times, networks means provider networks. The makeup, the listing of your doctors or hospitals who you're apt to see. So you have a choice of the type of plan that you choose. And now we're into open enrollment for senior plans, Medicare plans. November 1st is open enrollment for individual plans under 65. So, and there's choice there, opportunity to choose something that fits you and fits your needs. That's the key thing. If you're requiring maintenance, like you don't go to the doctor, but maybe for a checkup or a physical once a year, or maybe, you have a certain medical condition that's under control and you just see them for maintenance. You might choose one plan versus another. Versus, oh, I know I'm going to go in and have surgery, or I know I'm going to have a big ticket item and I need the best of care, then I might choose a different type of product for that. So, but you have choices.
Right. Yeah.
Next slide, please.
And also, various insurances cover various things. And so you always want to look and see what areas they'll cover, how much, what the percentage of certain things, because some will pay a certain amount for a particular service and the other may pay less for it. So you really have to compare and contrast and see what's best for you or your loved one. So that's really important as well. Okay.
Yeah.
You said go on to the next slide.
Yes.
Okay.
Next slide.
All right.
So hopefully it's big enough to actually see. So sometimes you wonder when you see our medical field has so many acronyms and abbreviations for this and that. So you see PPO versus HMO. What's the difference? Why should I pick one over the other? PPO stands for Preferred Provider Organization, which means preferred provider. There is a listing, a network listing of preferred doctors that particular insurance company wants you to see. So I can pick the preferred network A, or I can pick preferred network B, and it might be a different listing. It could be different by county. It could be different by region. One could be smaller than the other, and that would help to save me and what my cost would be. But know that a PPO, I have down a few characteristics of what a PPO is.
Right.
One thing a PPO does is it offers choice. There's more flexibility.
Right.
You don't have a gatekeeper like you do on the HMO. You can usually look in your directory, pick a doctor, call, and make an appointment, and go see that doctor. So that gives you choice and more flexibility.
Right.
Versus on the HMO side, which is a health maintenance organization, which means you have a gatekeeper, which is your primary care doctor, and that gatekeeper is literally standing at the gate for you. Okay, when you have it in mind, like what does he do? He stands at the gate. And in order for you to see a specialist, or in order for you to get durable medical equipment, or you need a wheelchair, a walker, a cane, you're going to go through that primary care specialist because he's caring for you.
Right.
He's actually maintaining what it says health maintenance. He's actually helping you, focusing on helping you to maintain your health.
Right.
And that's his whole goal.
Right.
So, on the
So let me just interject something, if I may. Because
Sure.
when you think about the PPO versus the HMO, which is what you have on the screen, the PPOs are more flexible, as you say. They will allow you to have more autonomy. They will allow you to pick what you want, as opposed to an HMO, which is more of a controlled situation. If you have an emergent situation, well, not emergent, but if you have a situation where you need to go see, say, for instance, a foot doctor, a podiatrist, they will make you get a referral from your primary doctor first in order for you to go to that podiatrist. And so the HMOs are very strict. They control the environment. They don't allow you to go to outside providers either. If I'm correct me if I'm wrong, they don't allow you to go to outside providers to get services. They want you to they usually encompass everything within their entity, so that way they can, have all, of course, the billing rights as well. And so that I wanted to bring that up because I used to be in an HMO, and I decided, I said, no HMOs. If it's an HMO, it's not good, because you have to, you're just so controlled, but the PPO is flexible. You can pick who you want. You don't have to get permission to go to that person. And so I just wanted to bring that up for the audience, so that if you have any questions or comments, please type them in the chat, or type them on the screen in the Zoom, and then we will respond to you. Go ahead. I'm sorry. I wanted to bring that up.
No,
it was something that yeah. Yes.
That's good. But I'm gonna add on to that, because you are right. You have a gatekeeper. You select a primary care doctor, and say, for instance, you have, let's say, a medical group, just out of the blue, for example, Prime Medical. Your primary care doctor is with Prime Medical. All of your specialists are within Prime Medical Group. Okay. So you have to select him, and when he goes to select a specialist, just like she says, it's controlled. So all your specialists are within that same medical group, which is key. Versus on the PPO with the flexibility, I can see a doctor in Prime Medical Group, but then I can also see a doctor in Healthcare Partners, or I can see a doctor in Memorial Medical Care, or something like that, because you have that flexibility. And another key thing that doctor mentioned was emergency. So emergency is one of those services that you can go anywhere. But one of the key things people don't remember is that when you go to an urgent care facility or you go to an emergency, you still have to come back, call your primary care doctor and say, this is where I went. Because it could actually be an out-of-network service, and you're left holding the bag for that cost. So you want to make sure, if that happens, that you call your primary care doctor and said, hey, you were closed. It was 7 p.m. I didn't know what to do. I thought it was an emergency, so I went here. Next available time, it's important to stay in touch with your primary care doctor, because he is your gatekeeper.
So you're talking about the HMOs now, right? You're not talking about the PPO. So you're basically saying, if I have an emergency and I decide I'm going to go to urgent care somewhere, and I haven't cleared it with my HMO, if you will, or gotten permission or a referral or whatever, and I go there and they're not covered under that blanket, then I'll be holding the bag for that. With regard to the bill will be on me. And so it doesn't. So that's not good. I'm not saying they're not good, but it's not something you would want. You will want to be very selective of what you pick when you are picking insurance.
Exactly. There's good sides about both. And on the slide before, we talked about having options and choice. If I was a mother and I had 5 children and they were all under the age of 15, which means they go for school checkups, they go for immunizations, they go for everything, I would not select a PPO plan. I would select an HMO plan so I can pay a copay every time my child went to the doctor. So you got to know what you're going to use it for and to know which side to select. But to finish out the PPO characteristics, so they may have a larger network. Typically, HMOs have smaller networks.
Okay.
They may have a gatekeeper. Depending on the type of PPO plan that you select, you can self-refer instead of going to your HMO primary care doctor and obtaining that referral to go see a specialist. PPO plans tend to have deductibles. So you know that a deductible, think of it as auto insurance. That $500 deductible or $1,000 deductible you have on auto before they fix your car, or they fix your car and you still have to pay, that same type of analogy is used in medical. You have a deductible, so you'd have to pay whatever it is, $250, $500, $1,000, $1,500, they're up to $7,000 now. Pay that first before your medical kicks in. Right. Normally, HMO plans do not have deductibles. You get first dollar benefit right away.
Right.
You have co-pays, which is that $10, $5, $25, that flat dollar amount is considered a copay. And you have, most of them have co-insurance, which is a percentage. You're paying 10% or 20% of something, or 30% of what the usual and customary price would be. One key thing about PPO characteristics is this last one that says they may have out-of-network benefits. Sometimes if the doctor is not in the network, depending on the plan you have, you still have a small benefit. Might be 50%, might be 40%, but you have something so you're not out of pocket for the entire cost.
Okay, so you mentioned something that I want to backtrack on. You mentioned that if I had children, I would take an HMO. And you're saying you would take an HMO because they have immunizations and they're going to be going to the doctor more frequently. And then you don't have to pay that copay, that deductible with the PPO. Is that the reason you said that? Okay, I just wanted to clarify that. I was like, okay, I wanted to make sure, because and the deductible is steep, and you cannot use that insurance until you pay that deductible. You'll use it, but you'll pay that deductible piece of it up front. It'll be your insurance that you're using, but the deductible will have to be paid before they start seeing you, or they'll, that's the trade-off, if you will.
But it's just knowing which way do you want to go. Why are you going to use it? Am I a 67-year-old senior, right, and I never go to the doctor, I'm healthy, I don't even take high blood pressure medication, I exercise, I'm in good shape? You might think, well, I could do an HMO because I'm watching my budget and the cost might be zero because I'm on a senior plan that doesn't cost anything. So it varies. Or am I a 70-year-old senior and I have some conditions, and that one doctor that I've been seeing for the last 20 years is only in the PPO network and not in the HMO.
Right.
So it might, you start weighing, should I, shouldn't I like that doctor, I want to stay with them. So you just have to know, how are you going to use it for you or for your family?
That makes a big
difference.
Make it work for you. If you've been seeing somebody for years, and then all of a sudden the insurance changes, or for whatever reason, and then you can't see that doctor no more unless you change with that, and whatever their change is with the insurance matter, that's not good either, because this doctor knows all my history. He's been with me for years, and he knows everything about me. And now I got to go and either go with him to another insurance provider, or I have to select someone else. And that's a big decision, especially when you have comorbidities, you have many medical conditions. That's really critical, that's a really, really critical situation, if you will. I want to just quickly say hello to Mrs. Holt. She has joined us. She is the co-host here tonight. And so I want to say hi to Ms. Holt. Can you hear me, Ms. Holt? Can you unmute yourself right quick and say hello?
Okay, can you hear me now?
Yes, ma'am.
Yeah.
All right.
Just wanted to say hello to you.
Thank you.
Yeah. So let's keep going. if you will, Mrs. Tonda, you are, you know, other information
Okay.
here with the group, with the audience.
Okay, I will finish out the HMO characteristics. We talked about the gatekeeper. Of course, you need referrals to see a specialist. It has the same copay and co-insurance depending on the type of HMO plan you select. Looking at the benefits is very important. May offer extra services or benefits. Most senior plans offer extra services. Some have transportation, some have vision or dental or
Right.
exercise or a lot of extra things. So you need to really look at that because maybe you don't want an HMO, but they might have extra services that you can use later on. So that's very important.
Right.
So
Especially the exercise.
network.
That'll sell me right there. If you got an exercise plan, like what is it, 24-hour fitness or something like that associated with your plan, I would definitely consider that plan, okay? Because that's expensive monthly. And if it's including your insurance, especially as we become seasoned, if you will, we need to exercise more and move more. You know, we want to have that insurance, that type of perk in our insurance. So go ahead. I'm sorry. I had to bring that in.
No, that's okay. But see, those are the characteristics, the things you look for in a plan. You may want a PPO plan, but when you look at the extra services that an HMO gives you, it sort of swings you in that direction.
Yes.
So, and the good thing about plans is you take it for a year, try it out, see if it works. Next year, if it doesn't, you can change to something else. So that's always a good thing.
Right.
Always a good thing. You have a select network of providers. On the HMO side, if you select Prime Medical Group, then you're going to stay with Prime Medical Group. If you select Healthcare Partners or Memorial Care or Facing Medical or, you know, Providence, you're going to stay within that network. So that's important.
For that.
And sometimes, yes.
Mm-hmm.
Sometimes what I can suggest is when you are looking at providers, if you have a specific specialist that you want to see, I say work backwards. Find what group your specialist is in, and then find a primary care doctor within that group. So that way, you know, when you go to that primary care doctor, he's going to send you to that specialist. Sometimes you got to work backwards in order to get there. Okay? And usually HMO plans cost less than PPO plans, believe it or not.
Okay.
It wasn't like that some time ago, but usually now they cost less than a PPO plan. So the PPO and the HMO are the two most common types of products that insurance carriers have. You have others like POS, point of service plans. You have HSA plans, health saving account plans, MSA plans, medical savings account. So you have different options depending on what you're looking for in a plan.
Right. But these are the main two that you're speaking of, the PPO and the HMO.
Yes.
Right.
These are the main two.
Okay. Okay.
These that get you the care you need. Absolutely.
Okay.
So that is it for me.
Yeah.
That's I just had a few slides.
Okay, that's fine. That was great information. That was a lot of information with the few slides that you have, because we talked about the various types of insurance, you know, PPOs versus HMOs. We talked about, let's see, let me go back to the other slide. If I can go back, yeah, why it's important to minimize or eliminate your out-of-pocket costs. And so a lot of times when a person has an emergency and they don't have any insurance, then they automatically will be put into Medi-Cal, emergency Medi-Cal. I don't know if you can want to chat a bit about that, but we can also talk about that. I'm kind of knowledgeable about it. Emergency Medi-Cal means there is an urgent matter, a life or death situation, and the person is needs coverage, needs insurance. And so they will put in, if the person is in the hospital, they have a medical emergency, they will put in for emergency Medi-Cal, which will only address that in medical emergency. and then they'll use that coverage to, get to pay for that particular issue that they're presenting with. And then after that, they either will go on to regular Medi-Cal if they qualify, or that will be ceased if not, and that happens a lot of times when people come from other countries and they don't have insurance. They will be put into the emergency Medi-Cal bracket if they, don't have insurance and they come to this country and they need some emergency assistance. So I just wanted to bring that up. Emergency Medi-Cal is a great resource for those who don't have insurance, but of course you don't want to ever have a situation where you don't have insurance. So I just wanted to that as well. Okay. So anything else you want to add to it, Mrs. Moses? If not, we're going to move back on to Miss Marcia, Mrs. Miller, who had a little challenge there. We're going to see if we can get that PowerPoint up. Is that okay with you, Miss Tonda? You done?
Absolutely. Thank you for the time.
Okay, don't leave though. We're gonna have a conversation.
Yeah.
We want to talk about this, okay? So let me just stop the screen share for a minute. And here we all are on the screen. And then can you all hear me, first of all?
Yes.
Yeah.
Okay, good. And now what I want to do, if anybody is listening in, they have questions or comments, please type them in the chat or type them in the comments section, and we'll be happy to respond to you. It's important that you ask questions if you don't know. Don't just feel like, oh, I don't want to say nothing. I don't want to, be put on the spot, but say something, because we're here to help you. We're not here to look down on you. We're here to assist you and make sure that you are knowledgeable about what you're dealing with regard to medical insurance and other matters related to caregivers, okay? All right, so now let's try the other PowerPoint. Let's see.
Let's give it a shot.
Let's give it a shot again. Okay, let's see, there we go. Uh-oh, I went past there. Hold on one second. All right, so can you see it on the screen? Not yet, huh?
Not yet.
I haven't shared it yet. Okay, hold on. Here we go. Let's see, uh-oh, that's not what I wanted to do. Okay, one second. Okay, and then to share the screen. That's not what I want. Oh boy. All right, every day is a unique experience, as I said, with the Zoom, and so let's see.
It's okay. Take your time.
Okay, no problem. We're gonna all learn today together, huh?
Yes.
Voila, I think I got it that time. Let's see, let me move this over a little bit and max it out. Okay, now you should be able to see it. Can you see everything?
We can see that. We can see it. Looks perfect.
Okay, perfect. So now we're going to switch over to Medicare. Mrs. Miller, as I told you, has had 10 years of experience as a Medicare broker. And so she's going to go through her PowerPoint now and share some important information with you all. Okay?
Okay, so here we are. This is Medicare Basics 101. This information is provided for educational purposes only. Just preference it. I said Medicare has not reviewed this PowerPoint. So this is just for your information.
Okay.
Okay.
All right, you want me to go to the next slide?
Yeah. Yep.
Okay. Well, you got to let me know. I got to.
Go ahead. Thanks.
Okay. Okay, so is that the next slide? Yeah. So I have to.
It's popping up.
Yeah, I'm doing it. Every time I hit it, it pops up. So
that's okay. So the big question is who's eligible for Medicare? So you have to be a U.S. citizen.
Sorry, I hit it too many times.
That's
Go ahead.
okay.
I'm sorry.
You have to be a U.S. citizen for at least 5 years. As you can read right here, there are also requirements in order for you to receive Medicare. So you must be of age 65 or older. If you are in fact younger than 65, you may have a qualifying disability.
Right.
And that would be something that I think that your doctor would also verify that you do in fact have a disability. If you are in fact younger than 65, if you are of age with a diagnosis or end-stage renal or ALS. So those are your pre-qualifications for Medicare.
Okay. So
Okay.
ALS, let me just say, is Lou Gehrig's disease, because a lot of people may not know about ALS, but ALS is Lou Gehrig's disease. So,
Yes.
yeah, you would either be end-stage renal disease, means you are on dialysis. So basically, you are going to the doctor 3 times a week to have your blood filtered, Monday, Wednesday, Friday, or Tuesday, Thursday, and Saturday, and then you are automatically eligible for Medicare. It doesn't matter how old
Yes.
you are. It doesn't matter, you know, nothing matters other than the fact that you have those 2 particular diagnoses. You are automatic for Medicare. So I wanted to bring that up. Okay. All right.
Perfect.
We're going to go to the next slide. If you're ready for that, Mrs. Miller.
Yes, I am.
Okay.
Again, we're just going to touch on how do you enroll, your eligibility and enrollment. So should you be automatically enrolled into Part A and Part B if you're on Social Security or if you're receiving those railroad benefits when you become eligible? You should receive your Medicare card. If you don't, you can call Social Security and speak with them in reference to receiving your Medicare card. And with everything going on, you may need to call Social Security because there's a lot going on that we're faced with right now. Or you can email, you can log on to Social Security at ssa.gov/Medicare.
Okay.
I don't think right now the offices are actually open. Tonda, I'm not sure if you're aware, you're on mute, Tonda.
Yeah, unmute yourself, Ms. Tonda. You can stay unmuted if that's okay.
You're fine.
Right.
I'm not sure if Social Security offices are open right now because I've had people ask me, and I'm not sure.
You know,
I
I'm
haven't
not sure either.
Right, but I think what they're doing is appointments only. If
Appointments
it's like urgent, they can't do over the phone, but they're not accepting people in. You have a reduced staff working because they're spread out social distancing.
Absolutely.
But not your standing in line type of thing that you
Absolutely.
normally have.
Right.
Absolutely. But again, if you haven't received your Social Security card, your Medicare card, you want to reach out to Social Security.
Absolutely.
They usually send them out once a year, or how does that work?
Well, you know what? It just depends on when you apply for it.
Right.
And then you'll get that, hopefully within a couple of weeks.
Okay. Okay. All righty. Let me know if you want me to go on to the next slide.
Next slide.
Okay.
Again, we're going to continue with the eligibility and enrollment. Your initial enrollment period is when you do, in fact, turn 65. So there is a 7-month window. So you have 3 months before your birthday, 3 months after your birthday, and the month of. So that is a 7-month window that you have, which is called your IEP, which is your initial enrollment period when you are eligible for Medicare. If you are in fact working past 65, you want to make sure, it's, I can't really see it too much, but.
What can't you see? Tell me what I need to do.
Just the if you could put us up top, that'd be perfect.
Yeah, I can. I'll move us over to the other side.
Okay.
Did that work?
Okay.
I moved us. Did that work? Can you see that on the screen?
No,
Tell you what, I can put us all the way out. How about that?
No, but she can minimize it as well. You can minimize the pictures by the little dash at the top. You can minimize that box so you can see the entire slide.
Okay. Yeah, that's what I just did.
Oh, okay.
Yeah, Marcia has to do it on her computer.
Oh, okay.
Mm-hmm.
Let's see.
Yeah, I moved it. I moved us so you can't see us.
Right.
I can't. Anyway, we're gonna move on. But if you're working past 65, you still have an initial enrollment period. So even though you're working, you're still eligible for that Part A. So
Okay.
you want to make sure that you do in fact contact Social Security in reference to your Part A. And actually you can still get your Part B as well. But if you have benefits through your employer, you can keep the employer's coverage, or you can apply for Part B.
Okay. So
Okay.
let me interject something about Medicare Part B, because I had a patient, and this particular patient, she had Medicare A, but she decided to not elect Medicare Part B. And when she did that, she incurred a large penalty, because from what I
Yes, ma'am.
gathered, if you do not accept that insurance when you're eligible for it, then you can have a very large penalty. And so this particular person, this patient of mine, had, I'm gonna say, she had a really large penalty, but she had enough money to pay that penalty too, okay? But she didn't want to have the month, have it monthly, because Part B is what you pay monthly. Is that correct, ladies?
Yes, it comes out of your Social Security again.
And so she didn't want that coming out of her Social Security check. She decided to not select it, but she had Part A, and so she had a large penalty. So what I ended up doing was calling the congressman, I think it was Congressman Ted Lieu's office, to have them check and see what that penalty was, because I couldn't figure out why she couldn't get it. And so they did a research, and they found out that she had not selected Part B. She had quite a few $1,000s worth of penalty that she had to pay. Good thing about it is that they weren't going to make her pay it all up front, even though she had the money, the cash in the bank to do it. They took a little bit out of her check each month to cover that overage that she had. And so she did finally go ahead and select it, but I just wanted to mention that. So if you are eligible for Medicare A and B, and you decide not to select, I think it's B, then you will have a penalty, and you will at some point have to pay it if
Can you hear me?
Yes, ma'am.
No, it's changed, because if you have to select within the 7-month window that she mentioned. Now you have to select A and B, and you'll get penalized. So you have to sign up for Medicare no matter what it is that you're doing, or you will pay a penalty. I just received some information in the mail stating that.
Okay. So you have to have A and B, or you'll get a penalty. So even if you but you can't have B without A, right? Because A is the one how would that work? So I could say, hey, I want B, but I don't want A.
No,
you can do
No,
that.
we're gonna touch on that. We're gonna touch on that in a little bit in the next coming screens. And just in reference to the penalty, that continues on forever. There is a way to get around it. There is a way to get around it if you qualify for something called LIS. But we'll talk about LIS.
What continues on forever, Miss Miller?
The penalty.
Oh, yeah, the penalty doesn't stop.
No, it doesn't.
Not unless you select it, at some point, and then it kicks in, but you still have that penalty. Okay, go ahead.
So one of the keys to remember that if you are employed and you turn 65 and your employer, talk to your HR. If your employer's health plan is credible coverage, and it it's considered credible coverage to where you don't have to take Part B, but you have to check. If you don't, you will incur a penalty.
Yes.
Okay.
So it's very important. If you're 65 and working, you need to be in with HR saying what's happening here.
Right. Exactly.
Right. Okay. Thank you. Go ahead.
Next slide.
Next slide. Okay.
All
righty.
Good interaction.
Now, let me see.
Perfect. So this is actually what makes up Medicare. The hospital coverage, your medical coverage, your prescription drugs, and of course your Part C, which is your Medicare Advantage plans. And Tonda really touched on that with the HMO and the PPOs. So we'll get to that in a little bit, but Tonda did an awesome job.
Okay. So you want me to go to the next one?
You can.
Okay. Let me make sure. Okay. Oh, there was some more. There it is.
That's
I was
okay.
scared to hit it because I thought it was going to go to the.
No, that's okay. And just on this slide alone, just to touch on what combines your Part A and Part B. When you have Part A and Part B, that's the only way that you can get Part C, is that you have both of those in place.
So you have to have A and B in place to get C.
Yes, ma'am.
Okay.
And
And
what
D-
does C cover? And what does C cover?
Yeah, that's my question too.
C, Tonda, you were going to say something.
I know, I was gonna say, C is actually your Medicare Advantage plans that includes your hospital and your medical insurance. So if you only had A, that's hospital insurance. If
Yeah.
you had B, that's medical insurance. So your A plus your B, okay, gives you C, Medicare Advantage plans, because it includes both of those.
Okay. So it's just a combination then, basically. It does,
Exactly.
there's no difference other than the fact that C includes A and B. Is
And
that
it also
Right.
includes D as well.
and
So D is
Yes.
included with C.
right? And so D, so when you sign up for A and B, do you automatically have C and D, or do you have to sign up for those?
No, you don't.
Okay, I just wanted to, we're gonna get into that too, Ms. Miller?
Yeah, absolutely.
All right, you
Absolutely.
ready to go to the next one?
Next slide. This is awesome.
Yes, ma'am. Okay.
So here we go. So again, just to,
Next one.
Yep.
Hold on.
that's okay.
All right, there we go.
We're going to continue to repeat ourselves a little bit just so everybody can really catch on to what we're trying to give to them, so you can understand what you're really getting with the A and B, because these are important. So you hear people say original Medicare. So original Medicare is your A and B. That's your hospital coverage and your medical coverage. So one covers for your hospital and one is for your doctor's visits.
Right. Okay.
Okay,
It covers care received from okay, so go to the next one.
go to the next one.
Okey-dokey.
So these are things that are coming up, which is a part of what Part A actually covers. So all the way from your hospital stay, from when you're in the hospital, your semi-private room, your meals, your skilled nursing services, your drugs, your medical supplies, and so forth. Your Part A premium, again, this is important because your Part A, it comes out of your Social Security. So if you have worked 10 years, or you may hear 40 quarters, then you're automatically eligible for that Part A. Otherwise, your 2020, I think it says 422 on there, you could potentially pay up to $422 or more. So again, if you've worked those 10 years or those 40 quarters, same thing, you're going to be eligible for that Part A. You're automatically going to get your card.
But you're gonna be 65 too, though, not just the 10 years. You gotta be 65 with 10 years, is that correct?
Yes.
Okay, I just want to clarify that, because I was like, well, I should have had Medicare a long time ago. If that's the case.
Well, you know what? If you're not 65 and you've worked 10 years, you know you're already in the bag.
Right.
Exactly.
Yes, ma'am.
You've got it coming.
You got it coming, huh?
You got it coming.
You want me to go to the next one now? You ready?
Next slide.
Yes,
Yeah.
ma'am. Uh-oh, a penalty can be applied for late enrollment. There it is.
Yeah.
All right.
That should have been on the Part B.
Huh?
That actually should have been on the Part B, which we were discussing.
Oh, okay.
That penalty. That lifelong penalty.
Okay, I'm gonna hit this until it, whoops, Went too far. Let me go back.
That's
to that.
okay.
Okay.
That's okay.
All right. So now that's the full slide.
So again, your Part B covers those doctor visits, your annual wellness, your labs, when you go to the lab to get your blood work and so forth, your MRIs, your x-rays. So that's part of your Part B.
Right.
The premium that you pay for your Part B for 2021 is going to be that $148.50.
Okay.
That's going to come out of your Social Security
Right.
or your railroad, whichever you worked. So if you aren't receiving Social Security benefits, I think it could potentially be more than the $148.50. It's just going to depend.
Yeah.
It's just going to depend on your income.
Yes.
So the premium will change based on your income?
Yes, it can.
Yes.
Yes.
Okay. Okay.
So if you're in the high roller section, you're going to pay more for your Part B premium.
Yes.
Wow. So, and I'm thinking about Medi-Cal, because if they're Medi-Medi, then they do not have to pay this premium. But before, they used to have to pay it. They used to have to pay this premium if they were Medi-Medi.
Well, you know what? If they're getting Social Security, that is still going to come out of their Social Security benefits. Is that $148.50?
Right, but from what I understand, if you are Medicare and Medi-Cal, though, they don't take it. They did stop it at one time. I don't know, maybe they changed it again, because I haven't been in the arena with the insurance for a minute.
Yeah, not that I'm aware of. I do believe you still have to pay for your Part B.
You do.
That's
Do you
yes.
recall them ever stopping it at one time? Because
I don't.
I recall if you were Medicare and Medi-Cal, which means you're low income, you did not have to pay for that Part B, that premium. And that was
not unless you're getting assistance some other kind of way to actually help pay for that Part B. It would still come out of your Social Security or railroad benefits.
Okay. Okay.
Yeah. So.
Okay.
Yep.
You ready for the next one?
Next screen.
Okay.
Again, here we go with that Part C that Tonda was talking about. So your Medicare Part B combines that Part A and Part B benefit into one, so you can get that Medicare Advantage plan that's offered by those private insurance companies. So Part C combines your A and B. Again, when Tonda said A plus B equals C, she was talking about those Medicare Advantage plans offered by those private insurance companies.
Okay, so you want me to go?
Which is good, because even though Social Security has the Part A and the Part B, when that private insurance company takes on that Medicare Advantage plan, they are required to pay the same level of benefits that if you had only Part A and only Part B, the original Medicare. They're required to pay that same original benefit if you were an original A and B, which is good. And what they do is add extra services and benefits onto the plan.
Absolutely.
Okay. Okay.
Where your gym would come in, where your prescriptions could come in, and your extra services and transportation. They provide, they're required to do everything A would do, everything B would do, and they throw in extra services and benefits.
Right, and some of those additional extra benefits are, like she said, your transportation, your emergency response system.
Okay.
Now plans are even offering pest control.
Really?
Yes, ma'am. So with that being said, if you have original Medicare, just the A and B, you don't get those extra benefits if you have C. That's the pros and cons of having the Part C, because you get the transportation, you get the over-the-counter benefits, you get that emergency response system.
What
so
kind
you want
of
to be
transportation
conscious.
do you get? You said you get transportation if you have
Part C.
C. C is A and B together, though, right?
But it's A plus B plus extras.
Oh, so they get some extra things too. So
Yes.
I just
And Right.
Okay. All right, I just wanted to.
Right, because Part A doesn't have transportation, Part B doesn't have transportation, but when you have a Medicare Advantage Part C plan, you're going to get A, Part B, plus those extra services.
Yes.
So they
Absolutely.
do see the deal for you.
Plans combined for A and B.
Do
Okay.
you have to apply for the extra services? Do you have to apply
You
for C?
don't.
How does it
Guess
become
what?
engaged?
Guess what, Miss Carolyn? They're free. Can I say that again? They are free.
No, you're misunderstanding my question though. How do you connect? Do you have to call Medicare and say, I need transportation to my medical visit so that it engages? How do you get to use your extra?
That's a great question, and people are probably wondering about that. It comes along with the plan. It's attached to the plan.
okay.
So you get that transportation, the over-the-counter benefits. You get the gym membership for free. That personal emergency response system, you get it for free.
Okay.
Along with that Part C.
So when you enroll into a Medicare Advantage plan, or you're looking at Medicare Advantage plans, which plans offer, because you have choice, which plans offer what? So here I have Plan X, let's say, and Plan X offers transportation. When I enroll in that plan, they're going to give me a toll-free number to that transportation company. All I have to do is call them and say, hey, I got a doctor's appointment on such and such a day.
Right.
Boom.
That's right.
They're going to give me a toll-free number of how to get my gym benefit. They're going to give me a toll-free number of who to call for pest control. That information is within the plan, and they have it all lined up for you.
Wow. Pest control.
Yes, ma'am.
I'm really shocked. I never heard that one.
You also, you know what, just to mention another extra, you also get post meals. So when you come home from the hospital, they offer you so many hours from a caregiver. They also offer you post meals in addition.
And this is any Medicare Advantage plan.
It's all free. It's in the plan.
I have.
All they have to do to engage it is call the number and say, I need this extra, and it's provided. Is because so many people don't know that.
They don't know.
They don't.
That's right.
I
They
want
sure
to
don't.
share this information
Yes.
with them, so I just want to make sure. All they have to do is call Medicare and say, I want the extra.
Make sure that
Okay,
they
you're
call
not-
their plan. They have to call their
Your
specific
plan.
plan. Where they have
the plan, their Medicare.
Blue Cross or
assigned
whomever it
to.
is.
Right,
So
exactly.
The Medicare Advantage has to be assigned to like an HMO.
Yes.
That's
Yes.
correct.
So
Yes.
Okay.
yes.
So you can't just have Medicare Advantage without, like you have Medicare A and B, you don't have no Medicare Advantage. You
Exactly.
have Medicare Advantage means that you have assigned your Medicare benefits over to an HMO. Is that correct?
Yes.
Now,
Yeah.
is it PPO also or just a HMO?
There's PPO there too as well. So
Okay.
you're looking at several different Medicare Advantage companies,
Yes.
plans,
Uh-huh.
companies, insurance carriers that offer this carrier offers this program. This carrier has these benefits. This carrier has this. So it's very important to know, am I going to need home health services? Am I anticipating surgery down the road? Or am I healthy and I just want a little exercise? So
Right.
when you're looking at your plans, the different plans, right, you're actually looking and say, well, what does this one offer versus what does this one offer? And when you enroll in that specific Medicare Advantage plan, then you have phone numbers, toll-free numbers in which to call to be able to utilize those benefits. They'll tell you the companies that they're using, the toll-free numbers, who to call, everything.
Okay, that's in the perfect world. Okay, I'll just say that. Okay, I'm gonna leave that alone, and I'm gonna say that's in the perfect world. Okay, because a lot of times most people do not know what
They don't.
benefits. I'm just
Absolutely,
gonna be
they don't
straight
have.
honest with it because
No,
many
that is, they
hospitals-
have no idea what they bought. It's like I
exactly.
bought a
I've worked
plan.
in many hospitals,
Yeah.
and I know that a lot of times the patients do not know what their insurance includes. And then
Exactly.
on top of that, nobody's really told them. Now they might have sent a packet out, a letter in the mail
Correct.
or something like that to them, but they
That's
really
right.
do not know.
So let me
And
piggyback.
that's-
Let me piggyback off of what you just said because it was such a poignant remark that you made because people need to build a relationship with a broker.
Exactly.
They don't have a broker to refer their questions and concerns to. So
Right.
they really don't know what's in their plan. So it's important to try to establish a relationship. And
Right.
let me say this, every year plans do change. So you want to check with your broker to see what has changed in your plan.
Right.
Well, also, I think around December, say December to January, you start to get all of this information coming to your mailbox about
Yes.
plans. I think it's important that people know that they need to sit down with whomever
The caregiver,
helps them with
their
such decisions.
caregiver. Yes.
Yes, so that they can read what these people are offering and make a more informed decision. Because I believe that this is where many of my former clients certainly fell through the cracks because they certainly didn't know that Advantage meant extra, so they never bothered to change
Right.
or update or any of that, and they were missing out on a lot of services that could have been extremely beneficial.
Exactly.
Right, we're gonna go to the next slide.
Okay. Marcia, you cutting us off. We were on a roll. What are you doing? But no, that's real though. I mean,
It is.
It is.
and that's where, let me just put my information in here right quick. That's where Caregiver Chronicles comes in as well. Because if you have a caregiver, we're going to work with that caregiver and make sure that they have the wherewithal to know everything about what you're needing. It's not just insurance, it's everything. And so this is a piece of it as well. So let's go to the next slide. Okay.
And here we go. This was part of Tonda's subject as well.
Okay.
Just touching on that, those HMOs, which had, you're in a network. Again, I'm going to kind of repeat what she said. You're in a network of doctors. So your primary care physician will refer you out to those specialists.
Right.
When you're in a network.
Right.
If you're in a point of service plan, now those particular plans, you can go outside of your network, but you still may pay a little bit going outside of your network. And that's called the point of service plan. Tonda really touched on those PPO plans too. You can go, you have choices. You have more of a selection of doctors that you choose, not just being in a network like an HMO.
Right.
Okay.
So
and when you
go ahead. No, but you go ahead.
When you have a special needs plan, again, as you see, those are people who are diabetic, have heart issues, or end-stage renal. Those are special needs. So those plans are specific for your care.
Right. And let me just talk about special needs because I've actually worked in a special needs program. And that particular program is a program where they are Medicare and Medi-Cal. They have to be both. And they have to have several or one or two comorbidities. In other words, like you mentioned, they need to have some diagnoses that are put them at a high risk. And so what the special needs plan does is they will monitor the patient when they discharge from the hospital, when they discharge from the emergency room, when they discharge, when they have a bariatric surgery, when they have a orthopedic surgery, and they will, monitor them, make sure they have all their needs at home because they want to reduce recidivism. They don't want them to continue to come back into the hospital or the emergency room when somebody could have just contacted them to find out what their needs are. So that's what the special needs plan is. And they have to be Medicare and Medi-Cal to be a part of that particular program.
Good point.
I worked in it, so I can read that one. I do know well.
Yes.
So let's go on. You ready to the next? Could go to
Ready
the next
for the
slide.
next one.
All right.
This is great. This is good information.
Oops, too far.
That's okay.
All right, that's it for that one. Okay.
So with Part D, again, when you have your Part A plus your Part B and you get your Part C, that Part D is going to tag along with it. So that's going to be automatic. So you get
You
that
have to
Part
have all
B,
three to get the D.
it comes automatic with it. It's a give me.
So if you have C, you automatically get D.
Yes, ma'am.
Okay, that's
Yes,
it. So
ma'am.
A and B, they can be standalone, right?
That's original Medicare.
Right.
So yes, yeah.
A and B can stand alone, and then you have C, which is Advantage. Is that correct?
Yes, it
Then
is.
D automatic if you have C.
Yes.
All
But
right.
you can
I just
also
wanted to make sure we were clear. Huh?
You can also get a standalone. You can also get a standalone prescription drug plan.
Oh, okay.
Yes, you can.
Okay. And why would you? How would a Medicare D? You can get that by itself.
Well, if you have A and B and you want to buy a separate prescription drug plan and not get C, you can do that.
Oh, I see.
Mm-hmm.
That's for those who are financially
Exactly.
if you will.
They do cost.
And you, when you turn 65, you need to do it. Otherwise, there goes another penalty that you would pay.
Oh, really? So if you don't take it at 65, you get a penalty for that? Wow.
Right.
So you have to be careful about those penalties. And I'm going to repeat it. You get the penalty with Part B and you'll have a penalty with Part D. So you really want to be extra careful time-wise when you apply for the Part B and the Part D. You want to be conscious of it.
Okay. Okay. Thank you. Ready for the next one?
Ready for the next one.
Okay. When to enroll. Oh, I forgot I had to hit the button again. Okay. Let's see.
That's okay.
Oops, too much.
That's okay.
All right, there we go.
So again, we're just going to reiterate and touch on the initial enrollment period. When you turn 65, you have that 7-month window, the month of your birthday, 3 months before and 3 months after. Annual enrollment period is where we are right now, is October 15th through December 7th, and all your plans that you apply for are effective January 1, 2021.
Right. So open enrollment right now.
Enroll right now.
Right.
Call your local broker. Call me, which we're going to give you my number at the end of this wonderful session.
That's right.
And, yeah.
Right.
And then the general enrollment period is from January 1st through to March 31st.
Now, what's the general?
One more time.
What's the general enrollment period mean?
Those are for those who missed maybe their initial enrollment period or either this period currently. They have another chance to enroll from January 1st through March 31st. So you didn't totally miss the train, but you almost missed it, but you can still get on.
Oh, okay. I didn't know that. I never heard that one. I knew they had the open enrollment, but I didn't know about the general enrollment period.
And again, for the
March. Okay.
Yeah, for the special enrollment period, that's if you qualify if you have anything like heart disease, if you're diabetic or that end-stage renal, that qualifies you for a special election period.
And the special enrollment period is basically anytime, or if you have a sentinel, not a sentinel event, if you have an emergency, a medical emergency or something like that, you can enroll, or how does that work?
I don't want to qualify it as a medical emergency, but if you have those specific, if you're a diabetic, or if you're not diabetic, or if you have the heart issues,
okay,
or you have end-stage renal, those are special election periods because you may not have always been in that health condition, but you've just become a diabetic, or you just had heart issues. So that's another period that you can enroll in those special plans.
Okay, so if you have a specific comorbidity, then you can get in there at another time. Okay.
Yes, ma'am.
You have a third option.
Yeah, you do.
Okay. All right, you ready for the next screen?
Ready for the next one. So these are just some frequently asked questions. And I think we kind of touched on these. If I have health coverage now, what happens when I retire? You have to be conscious of when you actually retire, you only have so much time after your retirement. So again, you want to incur those penalties with your Part B and your Part D. So you really need to make sure that you develop a relationship with a local broker
Okay,
or myself. But you
okay.
want to be able to ask those pertinent questions to someone so that you won't incur those penalties.
Okay.
My spouse is turning 65 this year and retiring, but she's 61 and not working. What do you do? Well, if your spouse is 65 years old and they're about to be Medicare eligible, but you're not, you're going to have to get a different plan. It's not going to still work because you're not going to be covered by his or her plan anymore. Once they become Medicare eligible and they apply for Medicare, you have to find another plan.
So, okay, so if I'm 65 and my spouse is 61
Yes.
and okay, and I'm gonna retire. No, that's not the way to say it. If he's 61, he can't get on Medicare? He won't be able to get on it when he turns 65, even though I'm on it because he was my spouse during the time that I was on it?
No, you can, at 65, he can join. If you turn 65 first, you can get Medicare. Whatever date he turns 65, he can have Medicare at that time. He can't have it beforehand.
He can have it till he gets that age, but he can still have it. But would it be under my tutelage, under my?
No,
So
because once you
qualify under mine.
65, right, once you turn 65, it becomes an individual situation.
Yes.
Right, so he's on his own until he turns 65. So a couple of things could happen here. He's just 61 and not working. If you had him retired and had a retirement plan, they may opt to continue him until he's 65 and bill you for that particular premium, or they may ask him if he wants to go on COBRA because you're turning 65 and coming off, so now he's eligible for COBRA, but that depends on the size of the group, or his other option would to apply for an individual plan until he turns 65.
Okay. Okay, thank you.
Mm-hmm.
All right.
And that's a really good point because a lot of people will have to be confronted with those issues.
Right.
Mm-hmm.
Okay, we'll go to the next one.
Yep. I think this is our last one.
Okay.
I'm turning 65 and have researched Medicare choices in my area. I can't afford any of them, not even Part B premium. Where can I find help? Well, there's financial help with your Medicare premiums. If you contact your local Social Security office, they can guide you and direct you to financial assistance.
Okay.
Again, we're touching on the Medicare Advantage plans. I'm looking for a Medicare Advantage plan, but I don't know if my doctors are in the network. How do I find out? Well, you can actually talk to your doctor. They'll let you know what networks they're actually in and let you know. So if you want to stay with that doctor, you've been with Dr. Brown for 15, 20 years, find out what plan he's in, or if you're recommending someone to Dr. Brown, find out what plan and network he's in, and then he'll let you know, and then you can apply
Okay.
for that particular plan.
Okay.
Tonda, did you want to say something?
No, I'm agreeing.
Okay. Okay.
I'm
Going along with
Yeah.
it. She's in agreement. She concurs, okay?
I
All right.
concur.
Okay, so that's the end of the PowerPoint. I think the next slide has your information,
That is it.
contact number. If you want to reach Ms. Miller, she is a Medicare broker. Her number is on the screen. It's 714-809-5743.
Click it one more time. There you go.
It's 714-809-5743. And then it's Marcia Miller 81 at yahoo.com. Let me say this to you as well. Insurance is one of the areas that a caregiver should be aware of. Because if you have someone that's providing your care, if they're seeing about you, if they're making sure that all of your needs are met, or they're supposed to be making sure that all of your needs are met. I'm gonna stop the screen share now. If they're making sure that all of your needs are met, then they would want them to know about your insurance. You would want them to know what your coverage is. You would want them to know the particulars of that insurance, and you also want to make sure that they are knowledgeable to the point where they know all of the perks, they know Medicare Advantage and all of the other things that go along with insurance. So that's important. And so I want to just say that Caregiver Chronicles, we also have a module for medical insurance. And so if you are interested, if you have a question, you can always type it in the comment or the chat. And Miss Miller or Miss Moses, either one of them, I will make sure that they get that information so they can respond to you. And you can also visit our website too at www.caregiverchronicles247@gmail.com, and then we'll be able to help you. Mrs. Holt, did you have something you wanted to interject as well?
Well, I have certainly enjoyed the presentation. It was full of very vital information, and it's good to know that these ladies are available to help navigate. It's a treacherous waters out there, I guess, and it's good to know that we have some very knowledgeable women that we can count on. We need to know these things because it's not just laid out all nice and neat. You have to do some investigation. So I appreciate your time and your efforts in coordinating and bringing all of this information together, so that it's very useful for anybody. Anybody can.
Right. I learned some things myself.
Thank you. Yes.
I learned some things myself tonight. So I want to thank you both for joining us tonight. Is there anything you want to say to wrap up? We're going to close out. We've been on for about an hour and almost 20 minutes. So we want to close out. Miss Moses, you want to give a final briefing on anything?
You know, I just want to say, don't feel as though you're alone. Even as a caregiver, feel that you can reach out. She gave you the website, you know, the email. Feel that you can reach out and ask questions, because that is so important. As it pertains to Medicare, yes, you're right. When somebody's getting ready to turn 65, their mailbox is overflowing with so much information. And as a senior, you know, sometimes it's way too much for them to try to absorb and take in. So just know that you're not alone. Reach out, and we're here to help.
And say something. Don't hesitate to ask.
Right, absolutely, absolutely. I mean, our whole goal here tonight was to bridge the gap with all of your questions and concerns to answers that you need. So, and you want to actively participate. You want to be proactive in participating in the healthcare that you're going to receive. So you really want to know about your plan from A to Z. You know, it's a lot of things that are offered right now with all the plans. Like we mentioned earlier, all the free things that you do get with having Part C. You know, you want to get that transportation, that emergency response system. If you're home alone, that is critical. If that comes with your plan, you know, having that over-the-counter benefit that you get every 3 months. You can get anywhere from $50 to up to $100 every 3 months, and that's free things that you can order from your plan, your vision plan, your dental plan. Those things are included with that Part C. So just know the difference. Know that someone is here to help guide you and through this whole maze of, you know, overwhelming information. But again, be proactive. Have a relationship with your local broker. Give me a call. I'm more than happy to assist you through this madness, if you will. So, so you're not alone. You know, we can't reiterate that enough. You're not alone. We're here to help you.
Right. All right. Thank you so much. Okay. Mrs. Holt, anything else? That's it?
That's it for me.
Okay, great. So I hope this information was helpful for you, those who are listening in tonight. It's very important that you take this information and use it or ask questions. Once again, send us an email. You can email us at caregiverchronicles247@gmail.com. You can contact us on the website, www.caregiverchronicles247.com, and we will be happy to help you make sure that you get the information you need. Next week, we will be talking about geriatric physical therapy. We have a special guest, doctor, that's going to join us. So we'll hopefully that you will join us as well. Thank you and God bless you. My prayer is that this information was helpful for you. Thank you, ladies, for joining me tonight. God bless and take care. Bye-bye. Bye-bye.
Thank you.
Bye,
Thank
Mr.
you. Thank
Bye.
you.
Bye.
Awesome job.
Thank you.
Thank